Welcome everyone to another exciting AWA AGORA show. This is our 6th episode of season 4, and we are honored to have had over 40 amazing guests on the show over the seasons. And I know today's guest will only add to that fantastic list. Our guest today is Laura Morris, and she is here to talk about designers as stewards for public health. Laura is an expert in healthcare interior design, recently returned to Perkins & Will to help lead the continued growth of their New York studio's healthcare practice as it expands into other areas of the U.S. and beyond. Welcome, Laura. I'm glad to have you here today. I know that everything is now a little bit of a transition with more being in the office and more meetings maybe happening, so I'm glad you could take the time today.
Yeah, thank you very much for having me. I'm excited to talk today with all of you. Today, I mainly want to talk about how I believe we are stewards of public health and how that's really been evolving and changing. I believe, and I'm going to talk through kind of these points that I have here on the slide, really how I, looking at it from a perspective of well and living design and how, clearly being a more sustainable project of any type is going to really affect our public health and moving forward. What I'm seeing is more of the convergence between the different markets that are out there, that it's not purely just healthcare anymore, that there's really a blending that's happening. I want to talk a little bit about behavioral health because I think it's affecting all of us. And if it hasn't touched us personally, it's probably affected people that we love and care for. How I think we're going to be closing the gap on a lot of disparity in healthcare. Whether it be access, whether it be really understanding disease and how it affects certain communities more than others. And then looking at how really this pandemic has done one thing, which is allow us to have a little bit more access and healthcare on the go. How are we going to take those lessons and the access that we gave and to really understanding and destigmatizing some of the behavioral health aspects and access to therapy, to talking to someone, as we move forward? How are we going to create those supportive environments, not only in healthcare spaces, but also where we work and where we play? I really think that this is a really interesting moment where we can partner with our clients, our health systems, to really think about almost the way that .coms used the spaces back to recruit, when in the .com era. There's probably some happy medium there. It's not just having daylight in a staff lounge, which is beautiful, but how can we go one step further? Can we create them quiet spaces? Can we create them places they can go and meditate, understanding the stress of what they go through every day and giving them the time and the area to be able to go and really put themselves back together. Really thinking about where access is happening to healthcare from a public standpoint. Many of us in an urban environment have no problem walking down the street to a Minute Clinic or a drugstore that has, a urgent care in it. But that's not the case everywhere. One of the interesting trends that we're starting to see is a lot more adaptive reuse of buildings that are vacant. So you think about the big box stores that are all closing right now, malls that are kind of sitting dormant. Those are huge real estate investments that are sitting there prime for care to be given in someone's backyard. Like it's the place they used to go shop, and now they can go and get their cancer care or their orthopedic care or go to physical therapy. We're going to where the people are. Working with health systems and understanding where those gaps are and understanding and getting the commitment to create nodes of health or wellness to really help stem some of the imbalance that happens. The access of the future. Clearly, I think, we're still going to have doctor's offices. You're still going to go and see your doctor in person. But I think there's going to be a lot more access happening closer to where the people are. So going back to like the transportation hubs, understanding where people are going, being able to stop and get the care you need wherever we need. We saw you could do it in a chair in a parking lot. So this was a pop-up testing center, little charrette that we did in our office with taking an old school bus and converting it. And what would you need on that to become a quick COVID lab? But there's nothing to say that this couldn't be a quick pop-up doctor's office, as it has worked out in my career, that I've had a vast experience working in pediatrics. And I think the interesting thing, we always start with the vision and the goal with our client, and understanding their brand, where they want to go with the facility, what the main drivers are. In the case of a behavioral health project, it's really understanding that those spaces, and in any pediatrics, I think the interesting thing is, you're not just designing for the 3-year-old, you're designing also for an 18 or maybe even a 21-year-old patient. That pediatrics runs this huge range, and from any other specialty, you've got to create space that all these different changes that you go through in life from those age groups, that you find that, I'm not sitting in a room at 16 that's all Barney, because, I don't really relate to Barney anymore. So being able to find a client that really is aligned in vision and goals with really creating living, understanding that the building really has an overall socioeconomic impact on the world we live in, and that it provides care, it provides all these other holistic means of creating, a new environment, a new experience for the patients that come into it. But it's really a mindset. And when you work with a client that you really see eye to eye with, and they appreciate and understand, the experiences and vision that you have, and they really also drive and push you to see and experience things in a new way, and really want to push the boundaries of what healthcare buildings and design can do. I think that's really where it is super exciting. And I feel like all of us say that we want to work with a client that's, thinks it like we do. It's not necessarily think like we do. It's pushes us to even think more and better than where we think we are right now.